Enter a new era of color and brilliance with Vizio's Quantum Pro 4K QLED Smart TV. With over a billion hues of vibrant color, plus wide viewing angle and anti-glare film, it delivers perfect clear picture no matter where you're sitting. It even comes with over 300 free TV channels and thousands of on-demand titles with Vizio Watch Free Plus. And of course, all your favorite apps are built in, so you can start blasting your favorite music, radio, and podcasts from iHeartRadio straight out the box. Head to Walmart.com to find the Vizio Quantum Pro today.
This is the Chrissy Swan Show.
We've got medical royalty in the studio.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today.
I mean, here she is.
Oh, with Dr Preeya Alexander.
I do it every time.
Every time.
I promise you, when we play it again and we're going to be taking your questions for Dr Preeya, I will not talk over the opener. Anything can happen. Welcome, Preeya.
Thank you. This is an amazing opener, friends. I'm excited.
I mean, we have been trying to get you in here regularly as our very own Dolly Doctor since we first went to air.
Yeah.
So we are very excited to have you. Everybody loves you.
We're busy people. Thank you, friends.
We are busy people. And as I said, this is going to be every Monday. Preeya is going to answer your medical questions. Hit us up on Instagram. Oozing, throbbing, whatever's happening.
We'll take it all.
But you were talking about being busy, and you are a very busy lady because you are like Dr. Chris Brown when he first started his career. He was this big superstar and he also worked in the vet surgery. You are a proper gigging doctor.
Yeah, babe.
And you're a radio star and you have your own podcast and you're releasing a cookbook.
You've made me feel good. This is a good place to be.
Oh, yeah, we're all about self-esteem
I love
here.
it. Thank you.
Your book is called Full Plate, and I have opened it to a random page, and it says zucchini slice.
Oh, yeah.
Now, controversial edition.
Zucchini slice?
No, babe. She's going to go here. Go on.
Okay, let's see how mystical you are. What is the controversial... Obviously, there's eggs and cheese and zucchinis in it.
Yeah, sister.
What is the controversial ingredient that I am going to have a problem with in this?
The bacon.
No.
Oh, I thought the bacon not being
the
in it.
bacon must be
The best bit.
So, okay, let me explain Full Plate. Before we get into, I can see where we're going here.
Yeah.
I just need to tell you, friends, this is a bloody book about easy, veggie-packed eating. Because
Yep.
I'm passionate about the body and the brain and what you eat can impact that.
And the rainbows. We're here for the rainbows, Preeya.
Thank you, sweet Jack. But I think it's gotten a bit muddy, a bit confusing. There's too much out there. And I just say to patients, I am a gigging doctor, you're right, I'm still in the clinic. Mate, any rainbow counts, frozen, canned, fresh. Let's simplify. Yes. Things are expensive. I just make little small tweaks. Like I might leave the bacon out of the zucchini slice. I know people freak out, but it's
Get out of the studio.
And Medical Mondays is over.
Yeah, done.
It ends quickly. But it's to reduce the processed meat for bowel cancer, the salt. You want to add it, go for it. The book is for everyone. Food allergies, kids. If you want to put the bloody bacon in, you do it, sister.
Preeya, why is there corn in the
mate.
zucchini slice?
Because it's a rainbow. And it's cost effective. That's why. And it adds a sweetness. Until you've tried it, don't knock it.
I've never tried corn in zucchini slice, and my mum used to make it for me for lunch because I love it so much.
Yeah.
But I just don't know if the zucchini slice needs the texture of the corn.
It does, because I
Okay.
don't put the bacon in.
Right, so it adds that, replaces that.
Correct. And all I'm trying to do is just add in the rainbow wherever you can. Canned beans, frozen, whatever it is.
Everything old is new again. There's tuna mornay
Oh,
in here.
mate, there's a tuna mornay. I'll tell you my secret there. There's no white sauce. I reduce the saturated fat. I use creamed corn. Increase the veg and it's delicious.
Actually, and if you're on Instagram, go to Preeya's Instagram, dr.preeya.alexander, because I did see a video of you making the tuna mornay.
Yeah.
Yeah.
My kids love that puppy. But can I just say, this is for people who don't know where to start. You're
Yes.
overwhelmed. You want one meal for everyone. You've got a gluten-free person at the table,
Yeah.
someone who's allergic to dairy, and you've got an infant starting solids. And you go, am I making 6 meals? No, you're not.
No.
Because the book has a key. Follow the key. I give you ways to adapt it. It's
Preeya,
just easy, yummy cooking.
I love it so much. It's getting back to basics and we've all gotten away from that.
yeah.
Preeya, you are going to stick around and finally answer our medical questions. But in the meantime, we're going to enjoy this little grab of you in your kitchen cooking Holy Mama.
Cut some rainbows. Got a little bit of cucumber. Let's shred a little bit of lettuce. We don't care. Just shred it, baby.
Yes!
Rainbows.
Rainbows!
Oh my goodness, I did not know you guys had done that. I'm embarrassed now.
The Chrissy Swan Show.
And finally, this is happening.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
Every Monday, we are opening the door to our very favourite straight talking normal doctor, Preeya Alexander. We're so thrilled.
Thank you, team.
Now, we've been inundated with questions from listeners that you're going to answer. We're going to do this every Monday. Slide into our DMs on Instagram if you want Preeya to have a crack. Question number 1. Advice for perimenopause symptoms. Am I going crazy?
Holy mama, this is a big one. You're not going crazy. I say holy mama a lot. I
No,
know.
we love it. We love it.
It's a Preeyaism.
It's best.
But what is perimenopause? Let's be clear here. Menopause is you haven't had a period for a year, so no period. Perimenopause is that lead up time to that. Hormones are going all over the shop. Estrogen, progesterone, your period cycle lengthening out starts to happen. You might experience vaginal dryness, skin dryness, irritability, sleep changes, hot flushes, lots of things. You are not going crazy. This is an entity we're talking about more and more. If you are experiencing stuff, you're in your 40s, because the average age of menopause in Australia is 51. But if you're experiencing anything, go and talk to a GP who's going to see you and hear you, who you feel safe with.
What do you say to the GP?
Yeah, good question.
What is the sentence, the opening sentence?
I would say, I have noticed some changes and I think it could be perimenopause. And then I would write down on your phone notes app before you go in whatever you've noticed. So cycle lengthening, I'm noticing I'm more irritable, I'm more teary, my skin is more dry, vaginal dryness is impacting my sex life, whatever it is. Put it down so you're ready to go.
I'm so sorry. Vaginal drama.
I thought I would be the child in this conversation, Preeya.
I have to be honest, I was looking to you to make
said
sure
no.
you were okay.
I'm sweet with this stuff.
You said it twice and I was trying not to
I've actually got a
laugh.
question, Preeya. These symptoms, because I'm a little bit obviously ignorant when it comes to this space, how long do they last for? Is it a couple years or 3 years that people go through this? Or
It can vary. So for some people it might be months, for others it can be years. But can you
Right.
imagine if you're dealing with all of this and you think, like this person has said, you're going crazy and you're not having the support that you need. So you come and talk to Preeya. This is a trigger for me to go, okay, I've got to start thinking about chronic disease risk. Let's do a blood pressure check, a cholesterol, diabetes check, a heart disease risk assessment. What are your bones doing? Are you high risk for osteoporosis? Is your cervical cancer screening up to
Oh
date?
my God, this
Your
sounds all
mammogram.
very depressing.
No.
And if anyone's like me, I would listen to that and go, I'm not going to the doctor.
Chrissy Swan.
Well,
But I'm keeping you healthy. It's a trigger for me to go, let's keep Chrissy healthy and let's not miss anything and optimize health. But there are things we can do for the symptoms, just so that our friends listening know, don't suffer silently.
See, I like the idea of them checking everything and being like and overanalyzing me because it puts my health anxiety at bay. You and I are very different in that space. I've never realised.
You're
Yeah.
a bit avoidant, Chrissy Swan.
Yeah, I
Absolutely.
Yeah.
All right, question number 2 for Medical Monday.
am. Just 1 second.
It's a psychology session now.
Everybody's talking about perimenopause. I feel like I'm going crazy because I don't relate to any of it. I don't have anything like that.
Great.
And I'm turning 51 this year.
And there are people like you out there. So I think it's important to realise that not everything I've just mentioned is going to be perimenopause. It could be a thyroid disorder, iron deficiency, which is why I check your bloods to make sure. Don't forget mood disorders like anxiety or depression can present with symptoms like fatigue and irritability too. So some people have something else going on. Maybe it's perimenopause, or maybe you're lucky and like you where you breeze through.
Is it possible that
Yes.
I'm not going to get any of this vaginal dryness and hot flushes?
Well, once you go through menopause, you'll notice as you get older, vaginal dryness can be a factor because the estrogen goes down, and that's when we'll talk, sister.
my vagina's
Without the
fine.
giggling.
My vagina's fine. All right, next. Everyone's talking about getting a flu shot. Do we need to get a COVID shot as well?
So flu shot, please, everybody. This is for everyone, okay? So the flu shot, if we can just say this, everyone over 6 months of age can safely get the flu shot. If you get a flu shot, it reduces your risk of getting the flu. Mm-hmm. If you do contract it, because it's not 100%,
Yep.
we don't sell it as 100%. If you still get the flu, it reduces severity. It's
Yep.
the seatbelt. You might get in the car accident, but you're less injured,
Yep.
right? So that's the flu shot. The COVID booster, the 2024 recommendations have come out. If you're over 65, consider a booster every 6
See,
months.
no one cares about COVID anymore.
Well, we should, because there are still people having severe illness and dying.
I know, but we just don't care.
It's not talked about, is it?
No.
Yeah, so we're talking about it.
I didn't
Yeah.
even know that you could still get a COVID shot. There you go.
Yes, and so if you're 18 to 64, you're immunocompromised, so you have a medical condition that impacts your immune system.
Yep.
Again, they've said a booster every 6 months. If you're like us, 18 to 64, well, you can consider it every 12 months, more frequently after you chat to your GP.
Right. So more critical for everyone to go and get now, though, would probably be the flu shot coming
Yes,
into winter.
flu shot.
Fantastic.
Yeah.
Thank you so much, Dr. Preeya Alexander. That was our first proper edition of Medical Monday. Go and get Preeya's new book, Full Plate. It'll sort your dinners out for the whole week.
The Chrissy Swan Show. The Chrissy Swan Show.
And it's Monday, which means one thing.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
The ultimate in bulk billing. You have access to a real life GP, Dr. Preeya
Yeah.
Alexander. Hello.
Hello, friends.
Last week caused a sensation, vaginal dryness, etc.
She laughed about that all week.
all week. Now, Preeya, let's cut to the chase here. We have received an email vis-a-vis UTIs. Oh. How do you stop them?
They are a pest. Now, let's go back to basics here.
They are a
Urinary tract infection is a UTI. That's bugs in the bladder causing a bit of a problem. More common in women because we have shorter urethras.
Yes.
Right? So it's easier for
Right.
bugs to get up there. Don't you start giggling. Oh, no.
So it's harder for them to climb up my hole.
Yes,
Yeah.
it is. It
Yeah.
is.
So UTIs are rarer in men. Yes.
And what about the sensation of feeling like your insides are about to fall out of your body
The burning
at the
and
end?
the stinging.
Burn, baby,
the-
burn!
Oh my God! Urine inferno!
Inferno, not bad. How do you prevent these puppies? Okay, the key lifestyle things. Drink a lot of water, flush that pipe out. Toileting, critical.
Yeah.
So for women, wiping front to back.
Right.
I just can see Chrissy Swan's face.
Can I tell you, I never wipe front to back when it's a wee, ever. Obviously a poo,
That is a
Okay, so
Daily
that's-
Mail headline right
like
there.
front to back.
They are
But
going to take this.
Yeah.
Chrissy Swan wipes back to front.
I would say 99% of women do not go all the way around the back when they do a wee.
Oh, mate, I'm a GP who's seen so many UTIs. I do. I'm scared.
I reckon you could be on your own, Swanee.
You're scared.
My daughter has been counselled so heavily about the importance of toileting, I'm telling you now.
Well, when you go, we're going to do a phoner.
Please, tell me.
13 24
Yes.
10. Do you, when you're doing a wee specifically, do you wipe from front to back the same way you do for a poo?
And let's just say this, that even if you've not passed a bowel motion, there are still bacteria around the anus that can be problematic. So I'm getting very medical now.
Well, really?
You've got a proper doctor here, friends.
Right, we've got urethra and anus so
Correct.
far.
And
We need a
vagina last
whiteboard.
week.
We need a whiteboard for
For
Preeya.
Medical Monday.
Where will we go next? I'm excited.
But can I say this? Prevention, another big thing is sex.
Yes.
So doing a wee after sex is a really good way to flush the bacteria.
I feel
How
like-
many more words?
Why do you have to wee after sex?
You flush the pipe out.
Also, what is sex?
Question.
Another question.
Next
Question number 2.
Do probiotics for your stomach work, for your gut health?
So gut health, big thing now. So much emerging research about the impact of the gut zoo or the microbiome. The
Yes.
billions of bugs in the gut.
Yes.
Amazing stuff. lots of things you can do to support the gut zoo because it can impact your mood. It can impact weight.
Well, it's like a brain.
It is.
Yeah.
It actually is. It's like, I don't want to get too nerdy here, but it is fascinating.
Yes.
Right.
The impact of the gut health and the gut zoo. Probiotics can support it. Yes, you want to make sure you're getting a good product. So go and chat to your pharmacist before you just go and pick something off the shelf.
Yep.
But also things like avoiding artificial sweeteners can support the gut zoo, is what I call it in the consulting room. Also eating lots of fruit and veggies and a wide range of colours.
Yes.
So you know how I say eat the bloody rainbow?
Yes, which
That's
brings
why.
us to your book Full Plate at all good bookstores now.
Yes.
Thank you, Preeya Alexander. Send your questions via Instagram for the next Medical Monday. We'll see you then.
Thanks, team.
The Chrissy Swan Show.
And it's time for this.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
Welcome, Preeya.
Hi, friends.
Thank you so much for coming back, given my
it here.
track record of laughing every time you say
Let's
a
see
rude
how we
word.
go.
Fingers crossed. Actually, these are not too bad. Send your questions to Dr. Preeya Alexander via us at Instagram. Slide into our DMs. This is an interesting one. How do I deal with uni stress or stress in general?
Yes. So now stress management is one of my passion projects because
Right.
we don't do it well often. We're often not very good at knowing when we're stressed.
When are we stressed?
Well, it's different for all of us. So, Jack, how do you know that you're stressed?
Mine probably manifests in anxiety and symptoms of sort of being nervous for no reason and things like that. That's how I
Okay.
identified it myself.
So everyone has different tells. For me, I know I've got uncontrolled stress when my sleep goes off.
Right.
That's my early tell. And if I ignore it, things get worse. I become hypervigilant, irritable, fatigued. And so I try and nip it early. Most people,
What's mine?
What is it?
I think maybe I start to feel like I hate everyone and everything.
Irritability.
Yes.
Yeah. So key
But then
thing is,
I'm such a good girl. I don't let that. I don't want anyone to know that I'm.
So it just festers up inside of you.
Yeah.
That's healthy.
oh, pay no later.
Good one.
So first thing is identifying.
Yeah.
When am I stressed? Stop it from progressing. And number two is there are lots of science-backed ways to manage stress. One, move the body
Yes. Maybe this is why I don't feel so stressed anymore.
because you're a walker.
Yes. And I don't drink. And I
Yes.
believe that those two things really are the best things I do for my mental health.
And I would agree with you. The reason I move my body is predominantly for my brain and the chronic disease risk and cancer risk, all of that.
Wait,
But
not for Instagram stories?
Not for stories. Not for stories. That's a little side joke. Well done. But yes, moving the body, particularly if you're stressed, if you do something high impact, you burn off cortisol, which is the stuff that makes you feel restless and fidgety. So doing
Yeah.
something high impact, great for stress. Eating rainbows, fruit and veggies, great for stress. We know that gut health can impact mood and stress. Getting lots of sleep.
This
And
makes sense.
It's not sexy, but it's the stuff that works. So when I see patients in the consulting room for stress, I'm prescribing them no screens in the hour before bed,
Yeah.
wind down, meditate, reduce caffeine. If you're feeling stressed and you're drinking lots of caffeine, it drives the stress response.
Yeah.
And alcohol, you've alluded to this, it might make you feel good initially.
Oh, yeah.
But afterwards, it can actually make you feel more anxious and
Yes,
stressed.
absolutely.
Yeah, absolutely. I'm living proof of that.
Speaking of alcohol, Swanee, next question.
What are your best hangover cures?
Well, the key one is obviously if you don't want to be hungover, don't consume alcohol, right?
I mean, Fred.
But Priya,
Don't need
I'm
a
not-
medical degree for that.
I'm not going to not do that. But Priya, what's something else?
is this question from you? Love
It's actually not.
Yeah.
So, look, the reason you feel this hangover,
Yeah, what is
irritable,
it?
fatigued, thirsty, it's two things. One, you're dehydrated. You've not consumed enough water.
Yes.
And alcohol's a diuretic, so you've urinated more, so you're depleted, you're dehydrated.
Uh-huh.
Number two is alcohol negatively impacts your sleep quality. So when you drink alcohol, you don't sleep as deeply, you wake more frequently, you often wake earlier and feel a bit anxious. That's the impact of alcohol on the brain.
Uh-huh.
And so then the hangover is really fatigue and dehydration.
So the night before, hydrating throughout drinking, like, right? Drinks of water throughout
spacing.
your drinks. Okay.
Correct. Yeah. Keep hydrated. And if you don't want to feel hungover, you can have a few drinks, but go to bed earlier and try and stop drinking straight before bedtime and have water instead.
Last question. Does Hydrolite actually work and help? Like,
Well, it will
scientifically?
help with hydration. Yeah,
Okay.
it's got electrolytes in it, but you can get cheaper options if you're trying to save your penny.
Give me one.
You're not going to do any of that.
Give me one. Give me a cheaper option.
No, I'm not going to give it to you. You have to go and investigate that yourself. But
I can think of a cheaper option.
Stop drinking.
Don't get blackout drunk.
Where's the fun in that?
If you want to be featured on Medical Mondays next week, slide into our DMs. As usual, bloody pleasure, Dr. Preeya.
Thank you, friends.
The Chrissy Swan Show. The Chrissy Swan Show.
It's Monday. Let's do this.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
I mean, everybody is living for this, Dr. Preeya.
Hi, team.
Preeya, have you thought about just ditching the practice and chasing the bright lights of showbiz full time?
Babe, I'm a GP at heart. I love it. I love my patients. I'm a nerd. You know, under all of this, there's a big nerd.
I'm sorry, but that is not a surprise to me. What do you?
Oh my goodness.
What do
You
you?
disguise it with chic outfits and stuff, though.
And that is big from you. Thank you. That means a lot to me. But oh my God, I feel a bit hurt by you.
Do you really think that you're not clearly a nerd?
I think I give like a little bit of a facade of like with
You
the
do.
outfit. Thank you.
You do.
And Willie, the hot husband. And
Yeah,
hey, team.
she's trying, Swan.
Come on.
Oh no, I am also a nerd, and I can recognise them immediately.
I'm going to cry in the shower so no one sees my tears.
Nerds are the
tonight.
best.
They are the best.
Embrace your nerdery. All right, let's embrace some questions because our listeners are bloody loving this, Dr. Preeya. This one, the two that we've got for you today may or may not be intertwined. Number one, what is causing my headaches all the time? That's not me saying that, by the way. That's a listener. Why do we get headaches? What's going on?
Look, lots of different things can cause headaches. I can't tell you without seeing you in my consulting room, taking a full history, how often are you getting them?
What are the
trigger?
most common
Yeah, that you see.
reasons?
I see migraine
Yeah.
and I see a lot of tension headaches.
Mm.
So tension headaches being muscular tension, the temporalis muscle, it can come from the neck, the
Yes.
facet joints. Often people are maybe grinding at night or
Which
stressed.
comes back to our question from last week about stress.
Correct.
Yeah, right.
And often for patients with tension headaches, not only am I involving a physio and stretches and heat therapy and medication to try and nip it in the bud to just get on top of the pain, but the stress management stuff, I'm also writing 100%.
Well, interestingly, I used to get headaches all the time. Like I always had Maxagesic in my bag and I would pop them like Tic Tacs.
Oh.
Since I started...
Friends, that can be problematic for your kidneys and
look,
your heart.
I'm not the doctor, so don't listen to me. But ever since I've been a walker, I do not get headaches.
And do you know that's probably a bit of stress management and also probably muscle strengthening
Yeah.
and release?
Yeah.
Wow.
And so it's most likely you were getting something like a tension headache.
Yeah.
Which I also get. And Pilates for me is the godsend.
Yeah.
It's getting the
Right.
muscles strong, stretching. Yeah.
Now,
Love that.
let's move on to something a bit sexier.
Oh, yeah. Do we have music?
I know, let me get some
Bow,
sexy
I'll
music.
Sing.
Can we
I can
have some?
sing.
What have we got?
Bow, 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 bow.
And
Music
you
again,
think that we can't all see that you're a total nerd. And that's your idea of sexy
Here we
voice.
go.
Oh, she can
Oh,
dance too!
yeah. She's grinding.
So I'm not necessarily a nerd. Do you see these little
She's trying to prove herself so
deflection?
hard.
Nerds like sex as well.
They do.
Yeah, they the most.
Especially with Preeya's husband. Hello.
All right. Okay. So, right.
Jack's a fan. I love it.
I am reading this as if, it's me, but it isn't. Someone has asked.
Oh, here she goes.
I'm just a Italian, looking very funny. Why is my libido low?
So many things can impact libido. And can I tell you, I see a lot of this as a GP. In all age groups, libido is a big concern. So, stress
Yep.
impacts libido. Sleep deprivation can impact libido.
Do women suffer with low libido more than men?
That's an interesting question. In my consulting room, I think because of the demographic that I see more women. But I think if you asked a male GP, they might say different.
Okay.
But look, lots of things. Medical conditions, things like depression, anxiety can impact libido. So
The mental
iron
load.
Deficiency, 100%.
Being touched out.
Yeah.
Sorry?
Being what, sorry?
Touched out.
What does that mean?
It means, like, I spent the first 10 years of motherhood just being touched out.
Oh, that's an
Like-
exciting way to enter the motherhood journey.
No, it means that
You've
there
had
are
too much touch.
all these little bodies and hands all over you.
Oh, not the
All
good
the time.
touch.
The last thing you want
Is someone to
is
touch
more
you.
of it.
It's true. It's true. When you've had chest to chest time for hours.
You
It's like-
own it.
But can I just say, whilst we're growing
Ride
together,
it.
Yeah.
that medications
pony.
can also impact libido, okay? So SSRIs, thyroid disorders. So I just want to say this. If you are going, I am not into sex. I want to be into sex, but I'm not. Chat to your GP.
I love it. Dr. Preeya Alexander, thank you so much. You should go and follow Dr. Preeya Alexander on Instagram too. Dr.Preeya.Alexander.
Yes.
There are some fantastic recipes. She says rainbows a lot.
Of course
and you
she
might
does.
see her hot husband every now and then.
And special gifts sent by Dr. Preeya to fellow nerds.
The Chrissy Swan Show. Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today.
Nerd alert.
Monday with Dr. Preeya Alexander.
Why do they always put a pause in there? Nerd alert. It's Dr. Preeya Alexander.
Oh, my goodness.
Everyone's favourite
A
nerd.
chic nerd.
Thanks, team. I'll take it. I'll take it.
People are going off for this segment because they can get to ask the spooky, embarrassing, humiliating questions. And they don't have to have eye contact with anybody.
Yeah, perfect.
It's the best.
Yeah.
Have you ever had circumstances in your clinic where you've wanted to laugh at a problem that someone's brought to you? Like, have you gone, oh my God?
I'm going to giggle.
Yeah.
After all these years, no. I've heard most things, but I laugh with my patients. So I've had moments where I'm like, I can't talk because we're both laughing so hard.
Can you give us an example?
At a shared experience. Well, when people go, this is what happened with my child, or this happened on a date, I get to talk to people about all sorts of things.
But I want to talk about things that's wrong with their bodies.
Yeah, no, we
she
don't laugh
can't
about
out
that
them.
so much.
Have you had to look at...
I've looked everywhere, Chrissy Swan. I've been in every crevice in the body. That's my job. And none of it's embarrassing.
I love it. I would be such a terrible GP because
You'd
I would
be wonderful.
No, absolutely. I'll be like, go out and have a shower and come back in. All right, here is question number 1 for you, Dr. Preeya Alexander, as part of Medical Monday. Ash has asked for the best way to deal with vertigo. Now, Jack, you think that you suffer from vertigo.
I like the
Yes.
way she says you think. Go on.
Well, no, I've experienced after a holiday a few months ago. I experienced it for like a week or two after. And then again last week after a hot shower. I had a cold, but I felt it after a hot shower.
See, I'm one Google search ahead of you.
Yes,
This is
she's
not
been
vertigo,
Googling.
is it?
Well, let's be clear. Vertigo is different to dizziness. So when patients come into
Okay.
my consulting room, the first thing I want to know is it lightheadedness or dizziness, that feeling of faintness, or is it vertigo, which is actually the sensation of the world spinning around you?
And isn't vertigo a virus?
Now, vertigo can be caused by lots of different things.
Yes.
This is the big takeaway. So, a common cause in young people is BPPV, benign paroxysmal positional vertigo. Okay. You can also have infective causes with a virus. You can have an acoustic neuroma, a benign tumour causing vertigo. Multiple
Wow.
sclerosis can present with vertigo. Strokes in older
Oh,
people.
no, okay. So now Jack is going to have to go and see a therapist.
Seriously.
No, but I would say, how do we manage it? It depends what the cause is. And can I tell you, when I see a patient with vertigo, we are doing some funky examinations on the bed, tilting your head,
Yeah.
looking at your eyes. It's full on. What's the cause? Because that determines the management.
I had the virus version.
Yes.
And I tried to get out of bed and I was like,
It's awful.
it was the weirdest
Proper
thing.
spinning.
Yeah.
So I've had it once, and it is the amount of sympathy I had for my patients. It is the nausea.
Yes.
It's debilitating. I said to
Yeah.
Will, call an ambulance.
Yeah, okay.
And he said no.
He said, baby, I think we're going to be okay, and patted my head.
Oh, that's Will. I want Will to
Beautiful.
pat
He
my
can
head.
pat yours
What
too.
about my dizziness and lightheadedness after a shower then?
So that's often because you've been in a hot shower, so you vasodilate, which means all your vessels kind of dilate in the heat. It's not as good at getting the blood back up to the heart and to the brain, and so you feel a little bit lightheaded. There's a little
Right.
bit less blood flow. But
I mean,
vertigo...
I know Jack a whole lot better than you do, Dr. Preeya. And if I was your GP, I'd say, when did this vertigo happen? Was it on a Tuesday after a big Saturday night?
It was.
Yeah, well, there you go. That's what it is. All right, let's move on to question number 2. This is an anonymous one, which means it's juicier than normal. Is it normal to have a bit of loose skin after a hemorrhoid?
Hemorrhoids. I see so many hemorrhoids. I hear about them.
Hang
I see
on.
them. I examine them.
What,
Yes.
you see them?
Yes,
You
all the
look
time,
up someone-
Chrissy. I do rectal exams all the time. So if anyone comes in with rectal bleeding, and can I just say, friends listening, if you have rectal bleeding, do not assume it's a hemorrhoid. Please let that be the message that gets out into cars
Yeah, okay.
and homes everywhere. Don't assume anything. Go and see your GP. It can
could
be other stuff.
Low quality toilet paper.
It
You got to
could
get
be.
3-ply, baby.
Or it could be bowel cancer.
Oh,
or
wow,
it could be
that's-
polyps. Yes.
Okay.
So please come and see us. I'm sorry to. Yes, I'm getting
that was
some
a
good health
real-
messaging out.
That was a real downer.
I know.
You
No,
know,
but
we were
team,
having
I'm just saying don't assume.
We were having a light-hearted
Giggle
gag
about toilet paper.
and you said bowel cancer.
Because I'm just saying don't assume.
Correct, Dr. Preeya Alexander. You should never assume. Thank you so much for joining us on this Monday. Our time is up. We will see you next Monday. Have a great week.
Thank you.
The Chrissy Swan Show.
This is happening.
Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
I would like a big round of applause for me, please, for not talking over the opener. Welcome, Dr. Preeya.
Thank you, team.
Socials have been going off as per usual with questions from beautiful Chrissy Swan Show listeners that are too embarrassed to go to their doctors and also very expensive. This is even cheaper than bulk billing, isn't it?
Yeah, it is.
Maggie says, should I do a voice for Maggie?
Yeah, do it.
Why do I always get told my blood is fine, even though I have extremely low iron? How do I increase my iron levels?
Iron deficiency.
That could be me. I've been iron deficient my whole life.
So I just did a post on this on Insta and it went wild. Because when I hear iron deficiency, friends, I'm thinking, what on earth is causing it? So the diagnosis of iron deficiency tells me nothing. I want to know
Right.
why.
Yeah.
So you might be iron deficient because you're not getting enough iron in through your diet. Maybe you're vegan or vegetarian. Maybe you've got increased requirements. You're pregnant. You're running marathons. Your body needs a bit more. Maybe you're not absorbing it. Are you a celiac? Are you losing it from the bowel, inflammatory bowel disease, bowel cancer?
God, again with
What
the
is-
bowel
No,
cancer,
but
Dr. Preeya.
friends, or are you having heavy menstrual bleeding? Are you bleeding vaginally and losing lots of iron? Are you
Jack,
donating too much
is that
blood?
what's happening to
Obviously,
you?
that is me.
But it's the why.
It's so as a GP though, Preeya, that feels like an hour-long consultation to go through all of those things.
So it can be. So often when I see iron deficiency, so I send my patient off for bloods.
Yeah.
Maybe I'm doing it because they're fatigued, maybe concentration, they're high risk for iron deficiency. I get the result, I book them in for a consult, and it takes a good, solid, whole consult to get to the why of iron and then manage it.
Can I ask you, I have been iron deficient my whole life. I've done all of those tests, all of them. There's still no reason why. Are some people just born like this?
So if you've done literally all of them,
I've had a camera
endoscopy,
I've had a camera up the bum. I've had a camera down there.
okay.
I've done all the celiac. My grandmother was a celiac, so they thought, oh, maybe that's it. That's not it.
Vaginal losses.
In which sense?
Well, I mean, look, there's no deposit,
lonely.
there's no deposits or withdrawals, if that's what you're saying.
Okay. This has become a GP
No,
consult.
I've been fixed up in there. I've got a
Okay.
You know,
This is
I've
poor.
got
An
a bottle
intrauterine
opener.
device.
Yeah,
Excellent.
yes.
So then, look,
Bottle opener.
it
It's
might
like a bottle
be
opener.
dietary. And so I would refer you to a dietitian. I would refer you to an amazing dietitian to look at what nutritional building blocks you're getting in. Is there something we can optimise? If everything has been excluded,
I'll never
fine.
do that. I'll never do that. I spent my entire teens and 20s being told what to eat and what not to eat.
No, but
by
Dr.
somebody.
Priya knows a good nutritionist. You've
I
told us
do.
that.
I know a really
lovely
good
one.
dietitian.
But they'll just say eat spinach and eat steak.
No, they'll give you some tips and tricks and putting it with vitamin C to increase the absorption. Lots
I
of
do
little
all
and look.
that.
Yeah,
I
okay.
do it all.
Okay.
She'd be a tricky patient.
Right now I'm going, holy mama.
All right, next question, Swanee.
A question from Anonymous regarding mental health. Can the body feel symptoms of anxiety, like tight chest or headaches, if you don't think you're anxious?
Yes, yes, and yes. I have had an experience where I've had chest tightness and it was related to anxiety, and I did not think that I was anxious or stressed at the time, but when I really reflected and treated myself like a GP,
Right.
I went, I know why this is. I've just had a friend diagnosed with something really serious. It's made me really anxious about my health, and whilst I'm not feeling persistently anxious, this is the physical manifestation of my anxiety. So we're not always that good at tapping into, you know, oh, I am a bit stressed and anxious right now, but the brain is a powerful thing.
Yeah.
So you might have some chest pain from a musculoskeletal thing. Maybe you did something at the gym. Maybe you've carried a heavy backpack. The pain is real, but the brain can amplify it.
Right.
Absolutely. So the brain is bloody powerful. You know, we know irritable bowel syndrome, brain-gut interaction.
Yeah, right.
They're talking to each other. The brain is very powerful.
Too powerful, some would say, Priya.
That's very interesting.
It is.
Because people always think panic attacks are like, oh, I've seen that, I have an attack. Or
No, not necessarily.
No, it can build up.
Or it can just happen out of the blue. Plenty of patients say to me, I was at home, it was in the night and I had a panic attack. There might not be a clear trigger. So the brain is powerful and
Very
anxiety can be
interesting.
really significant.
The Chrissy Swan Show.
And lucky you, because
Need
look
a
who's
doctor?
here.
Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
Welcome, you magnificent creature.
Hello, friends.
Hey, Priya.
I've got a unrelated question.
Go on.
What's
Could
for
be
dinner?
anything.
No, I'm joking. Why, when I make an appointment at 4:30, do I not get to see a doctor until 5:15?
That's called running late. Actually, 15 minutes I consider normal. I'm sorry, Chrissy. That's 45. I don't tend to run 45 late unless we've had an emergency. Things happen in our consulting rooms I can't even tell you.
Have you heard of like text message platforms that tell your patients that
They
it's going to
could.
be late?
We sometimes call people if,
Yeah,
if
do you
an
not get a
emergency
call?
happens.
Never. I've never ever got a call.
My clinic always calls. Do you know that's the one
That's
time
nice.
I'm not savage? That's the one place I don't get mad about lateness because I can imagine what the doctors are dealing with.
Yeah, because
Thanks,
also
Jack.
you're sitting there in the waiting room convinced that you're about to die.
Correct.
Yeah.
So he's
you
like,
can
I'm going
wait.
to take 45 minutes too.
Yeah.
All right.
Question number one, Swanee.
Yes, we have taken your questions on social media. Some of them are anonymous, some of them are not. Sophie wants to know if there are any natural ways to get rid of skin tags. And an addendum to that, what is a skin tag?
So skin tags are those little excess bits of skin that you might notice around the neck, sometimes under the armpit. They're like you can flick them.
They're disgusting. They look like little kitten tits. Do you know what I mean?
They're very common, friends, and they often occur with friction. So you might wear a necklace that rubs, or if underwear rub, they can occur on the groin line, but it's often that friction.
So you're not born with it, baby?
No, they often they come in your life.
They grow like, you know, roots of trees under your arms.
They can grow in areas of friction, but when this person says natural, I'm wondering what that means.
I'd
But
take to them with a set of nail
you
clippers.
can. So
Stanley
we can
knife?
snip them, we can freeze them, and if they're particularly large, I'll refer you to a dermatologist or plastic surgeon to have them removed, depending on where they are.
I had one on my eyelid.
Yeah. Yep. You can get them really anywhere.
Do you
Skin
remember?
tags.
We were working
Yeah,
together.
you had to
and I was
have
like,
the-
I've got to have a morning off. I've got to go and see a plastic surgeon.
there you
right.
go.
And I waited so long to get in to see him, and then he went, tip, and that was it.
And they're benign. That's the other thing to tell people. So they're not cancerous. If you've got a skin growth, though, it's worth just getting it checked.
Of course.
But skin tags are benign. And, yeah, they just occur due to friction.
Go see a GP, get it
Come
snipped.
and see us.
Or come see me and I'll take it off with a set of nail clippers. Shelley has asked about how long it should take for her cycle to start back after having a baby and whether they come back worse.
No single right answer here, friends. So it's different for everybody. It depends on whether or not you're breastfeeding. Depends on lots of things. So for some people, after childbirth, they're having a period at 4 weeks. Holy mama. Some people who are breastfeeding don't get return of cycle. So if you're exclusively breastfeeding, some people use lactational amenorrhea, so breastfeeding no period, as their form of contraception.
Which is an old wives' tale.
No. Lactational amenorrhea. You have to meet certain criteria. Baby under 6 months, exclusively breastfeeding, not having long gaps in the feeds, no return of period. But you can use that as your contraception. But I know this is cool. How nerdy and awesome is this? But the answer is it's different for everybody when your period returns. And so if it's not returning and the reason you're asking is, I'd like to consider another baby, pregnancy, that's when you come and see me, GP.
Thank you so much for coming in. We'll see you next week.
And thank you for bringing Holy Mama back. We haven't had a Holy Mama for weeks.
Holy Mama.
The Chrissy Swan Show. Need a doctor? Skip the waiting room and speak to a doctor online with Instant Scripts. Visit instantscripts.com.au today. Medical Monday with Dr. Preeya Alexander.
Just out here doing God's work, Dr. Preeya Alexander.
Hello, friends.
You have been sending us your questions, and keep your eyes peeled on our socials for when we throw it out there. What's your question for Dr. Preeya Alexander? You can stay anonymous. I like the anonymous ones because it means they're juicier. Nishi says, I use a $50 acne cream I use every night, but I have missed one by accident and my face is bad. What do we say to Nishi?
Oh, acne is a tricky bear. I don't know if it's from missing your cream one night though, but acne is a really complex cat. There's often lots of different things happening in the skin. You're getting the plugging of the follicles. You're getting abnormal keratinization.
And it's different from pimples, isn't it?
Yes. Acne is... So having a single pimple is different to the process of acne, where you're getting this stuff I'm talking about, the blocked follicles, the abnormal laying down of skin, and then often some bacterial proliferation.
Yeah.
And so acne we can manage in different ways. If you're really red, sore, we're going to introduce either topical, so laying on the skin, or oral antibiotics.
So sore, doesn't it?
It can be. And if it's that sore, Chrissy, like I've got options. We can think about the pill in women with acne because it can actually help reduce the amount of testosterone.
When I suffered from acne, Dr. Preeya, I did a couple of different steps and then I was put on Roaccutane.
Yeah.
And I've got to say, it did God's work.
So if people have severe...
It dries you out from the inside.
Side effect is drying, so you want to moisturise. But for people who've got severe, painful acne, that is direct referral. That needs oral retinoids and that needs a dermatologist.
So see a doctor. If you've got really bad acne, just go and see a doctor.
Or even mild acne, friends. You don't have to put up with stuff.
Have prescriptions and drugs and stuff changed over the years? Because I remember when Roaccutane came out, it was like, oh my God.
We've got other options.
Oh, fantastic.
Right.
So as a GP, please, if you've got skin and you're going, I want to do better this, or your child, we can do stuff. It can be topical, it can be oral. We can go at it from multi-prongs and bust the myths. Eat chocolate, it doesn't cause acne.
It doesn't. And really, if you've got an illness of any description, disease, whatever, make sure you go to the doctor every 2 or 3 years and just go, what you got? What's new?
If you've got an illness, come sooner. I would
Wait
say.
3 years.
No, but like you're on...
What you got?
No, but you know what? You get prescribed something and then people stay on it for 20 years. I've got a friend who's been dealing with a very chronic, serious illness. I'm like, have you popped back in to see what sort of medical breakthroughs have occurred, since you were diagnosed?
Come and check in with us.
Yeah, come and check in.
We're friendly people.
All right, next question is about the self-cervical screenings.
Yes.
What is this? Because pap smears, I always forget.
So, friends, this is a game changer. So if you are due for your cervical screening test, you've got a cervix, you're due.
And they used to be called pap smears.
They did used to be.
All right.
You come into my room, Chrissy Swan, Preeya, I've gotten a reminder. I'm ready for my cervical cancer screening test because I don't want to get cervical cancer. And I go, okay, Chrissy, you've got options. You can do a self-collect swab. I'm going to give you the kit and the instructions. Head into the bathroom, take your own swab.
What, do you have to lay down on the floor?
No. Often you can either squat or you can put your foot up on the toilet seat.
Okay.
We give you clear instructions, and really the self-collect swab is looking for HPV, human papillomavirus, which causes most cervical cancers. That's option one. You can still
How far up does it have to go?
We
Is
give
it
you
like
clear
a code?
instructions. There's a mark
Okay, great.
on the swab.
Fabulous.
Or, Chrissy, you might say, you know what, Preeya, I'd prefer for you to do it. It's called a clinician-collected sample, and it's like the pap smear.
What sort of
You
freak is going to say, I'd rather
Some
you...
people go, I'm here anyway, but the key things to know are whether you do the swab or I do it on the examination bed, we're equally effective at detecting HPV, human papillomavirus, so they're really good tests. Number 2, lots of people say to me, I don't want to do it, Preeya. What if I don't get the right place? What if I miss the...
Yeah.
There are checks and balances. So if they don't have enough cells on the swab, they let us know, unsatisfactory, repeat it. If there's lubricants or gels that impact the reliability of the result,
He's like, what were you
they
up
tell
to
us.
last
Yeah.
night?
Hey,
They
Tanya,
tell us.
you've been busy, dog.
But it's a great option, friends. I get excited about this,
I can
but it's
tell.
a great option.
Dr. Preeya Alexander, we love you. Go and follow Dr. Preeya on Instagram and make sure you get her book, Full Plate, if you haven't already.
Cook up a storm.
Now check this out.
The Chrissy Swan Show is a Nova podcast. For more great comedy shows like this, head to novapodcast.com.au.